Welcome, everyone. Thank you so much for joining us today. My name is Dr. Louise Ivers, and I'm the director of the Harvard Global Health Institute. I'm delighted to welcome you to HGHI's virtual coffee sessions series. This series is designed to explore and discuss the role of partnership and collaboration when working to advance global health equity. We welcome you to mark your calendars to join us on the last Friday of every month at this time for future sessions. I have a few notes. The session is being recorded through Zoom, and the recording will be made available on the HGHI website and our YouTube page in the coming days. We will have time at the end of the presentation to answer questions. So if you have a question, you can submit it through the Q&A feature on the bottom of the screen, and we'll do our best to answer those questions during the second portion of today's event. So with that, please allow me to introduce our speakers. Today, I'm delighted to be joined by Dr. Beth Holt, Diana De Silva, and Jhaki Mendoza, who will be presenting on StITCH, Transforming Hepatitis Care Through Shared Partnership and Leadership. Dr. Beth Holt is the Global Primary Healthcare Associate Director of Health Systems at the Harvard Medical School Center for Primary Care, where she leads the co-design and implementation of StITCH, a primary care system strengthening program to design and scale up a new person-centered model of care within Vietnam and the Philippines. With over 7 years in the health and social impact sectors, she brings a multidisciplinary perspective as an Australian-trained medical doctor, applying her experience as a clinician, researcher, and a consultant in the US and Asia Pacific to reduce health disparities. Diana Rose De Silva is a patient advocate and researcher based in Sampaloc, Manila, Philippines. She currently works as a research assistant at the StITCH project, contributing to the development of a patient-centered primary care strengthening model. Diana is a national officer and leader of several patient support and advocacy groups for Filipinos living with hepatitis B and C, and has represented the voice of people with lived experience at international events in Geneva and Bangkok. Jhaki Mendoza is a medical anthropologist specializing in chronic conditions and people-centered healthcare. She has led the patient journey mapping research component of StITCH Philippines and co-produced recent research alongside the Yellow Warrior Society Philippines. Jhaki's past work includes mixed method studies exploring the lived experience of individuals with chronic illnesses such as hypertension and diabetes, and works related to early childhood development, nutrition, and food security. What a lineup. I'm delighted to have you all here. With that, it's my honor to pass it over to you, Beth, Diane, and Jhaki. Thanks.
Okay. Thank you, Dr. Ivers, for the introduction. Greetings, everyone. Thank you for being with us for this webinar. Before Beth, Jhaki, and I delve deeper into our talk, I'd like to first introduce myself and share with you all my story. My name is Diana Rose De Silva. I am patient advocate and auditor of Yellow Warrior Society of the Philippines. I am one of the 10 million Filipinos living with hepatitis B. I'm the only member of my family who has this disease, and few of the people with courage to share it into public. In the Philippines, to live with hepatitis B is to live with confusion, anxiety, and isolation. I first learned that I had hepatitis B when I was 18 years old. Because of the workplace screening, the nurse told me that there was no cure and that I would be declared unfit to work. I was devastated, but I needed the job to support my college. And I fought to show that I was healthy and had no symptoms. And thankfully, got hired. The same is not the case for many Filipinos. It wasn't until 10 years later, when I had my second child, that I visit a gastroenterologist. Even then, I was left feeling overwhelmed with questions and worries. I was too afraid, too shy to ask the doctor the things like, how long do I have to live? And will my husband leave me when he finds out that I have this? So I relied on Google for my question and found the Yellow Warrior Society of the Philippines. Through them, I had all my questions answered. But even more important was the social and emotional support that up until this point I never received. Not from my doctors, not from my family, who themselves were just misinformed about the hepatitis B as I was. They pushed me away for a time, making me feel isolated and stigmatized. I was too scared to open up to anyone else for a while, including my own husband. Back then, I thought to myself, it is not the disease that will kill me, but the discrimination. After joining the Yellow Wire Society of the Philippines, I no longer felt alone. It gave me hope for the future, learning that there are effective treatments. I could live long and healthy life, and that the people I love can get protected through vaccination. They gave me the strength to go back and talk to my family and my husband. And now, to stand and proudly share my story in front of you today. But it devastates me to know that there are still many others out there who think that hepatitis B might end their life just like I did. But I also know with the correct information, support, and connection to others, we can empower those missing millions to live healthy and fulfilling their lives. And that is why I joined as a member of Yellow Wire Society Philippines. Together, we fight for the better access to testing and treatment and protection of our basic human rights. And and the compassion and acceptance from our community. With the StITCH project, I am grateful to have a platform where we can change insights, supports one another, and work towards more inclusive and people-centered healthcare solutions. Now, I'd like to invite my colleague Beth in the conversation. Beth, when you first came to the Philippines for the StITCH project, what was behind your choice to push to invite patients and advocate for person-centered care in the Philippines?
Thank you, Diane, and hello, everyone. And Diane, thank you again for sharing your story with this group of people. I know it takes a lot of courage to come in and to show your whole self, and we appreciate it. And that's one of the reasons we're so excited to have this partnership. But to answer your question, what was behind this choice to invite patients and advocates like yourself? StITCH started out back in 2022 as a multi-sectoral collaboration with the goal of co-designing, implementing, and then scaling and sustaining a model of care based at the primary care level for people living with hepatitis B and C. And here on the slide, you can see the range of stakeholders involved, as well as our wonderful core team that stretches from the US to the Philippines and Vietnam. And from the outset, the goal of the model of care that we would design together is that it would be people-centered. And to us, that means it achieves what we call the 5 Rs, which will be on the next slide. That means ensuring that people who engage with this model of care get the right care at the right time, in the right place that's convenient for them, by the right team, and in the right way. And importantly, defining what was right according to the community and the users of this model of care that it's intended to serve. So we started out, Jhaki and I, back in 2022, trying to understand what was most important to people by using a research technique called patient journey mapping. And that involved interviewing around 30 people from each country living with either hepatitis B or C, and to varying degrees of access and very different experiences with accessing healthcare in each country. And it was in those interviews, particularly in the Philippines, that we first learned about how deep and multifaceted the challenges were that people living with hepatitis were facing, not just in terms of maintaining their health, but in terms of these social aspects, and particularly employment-based discrimination, which Diane, you shared about. So at that point, we had come to learn about the Yellow Warriors through a local connection through UP Manila that Jhaki will talk about more shortly. And we were able to invite some of the early members to what we called back then in 2022, early 23, a research validation meeting. But we quickly realized we were going to need a lot more than that. And if it was we were truly going to be able to address some of these really deep barriers, we were going to need these YWSP members at the table as part of our team. So subsequently, I think it was World Hepatitis Day 2023, we signed a pretty unique 4-way memorandum of understanding between the local government in Tarlac of the Philippines, UP Manila, Harvard, and the Yellow Warrior Society of the Philippines. And yeah, since then, it's been over 2 years, and that relationship and the nature and depth of that partnership has continued to evolve over time. Just a few examples that I've had the privilege to observe is in terms of implementation, the Yellow Warriors officers started as relatively shy, I would say, Diane, attendees at some of the research and early workshops. And over time, it was amazing to see them become really active, not just participants, but leaders in this co-design process that we went through. And to this day, now confident facilitators in the quarterly implementation review meetings we have to continue to improve the model of care. And in terms of research, back in 22, I mentioned we did this patient journey mapping. This year, we have extended within both countries to a new province, and that has involved in the Philippines repeating this journey mapping study. And what you see on the screen now is actually the result of research done and collected by Diane, Jhaki, other Yellow Warriors members who are themselves now research assistants and data collectors in the team. So that's been a wonderful evolution, and I know we'll talk more about some of those examples later. But I'm interested, Diane, you've been here really pretty much since the beginning. How does it feel to you now, being part of this partnership?
I'm glad that as patients, we will experience a person-centered system in our healthcare. After being members of the co-design process itself and interacting with healthcare workers in that safe setting, our fear of communicating because of discrimination and stigma has lessened. We are proud to have played role in bringing the model of care to healthcare providers, which we the patients are finally benefiting from.
And we're really proud to have you there as well.
Thank you.
Jhaki, obviously this didn't happen overnight, but Diane mentioned this, safe environment that we have to interact for patients, for healthcare providers, researchers to all come together. Can you talk about some of the strategies we've employed to enable the evolution in this partnership and our roles over time?
Yeah. So hi, everyone. Thank you for tuning in with us for this webinar, and I'm happy to have joined this group and share with you our experiences. And thanks, Beth, for that question. I think one of the strategies that helped us is having a leadership support that recognizes how important community partnership ever since the beginning of the project. On this slide, on the leftmost photo, you can see here Dr. Jane Usong, our project leader for the StITCH Philippines, and Chris Munoz, who's a former president of the Yellow Warrior Society Philippines. And thanks to them, they go way back and they've actually started many initiatives advocating for people living with hepatitis and raising awareness about hepatitis in the Philippines. So when we started the project in the Philippines, we actually didn't have to start from scratch when it comes to community participation, because the openness for collaboration was already set out in the beginning. And another essential strategy has been valuing community knowledge as expertise. The Yellow Warrior Society have been with us in the forefront. We've acknowledged them as critical source of information for informing our research, policy, and the healthcare design that we want to produce. That's why we've made them not just like positioned out there as source of just anecdotal inputs on what it means to be living with hepatitis, but they are there as co-stakeholders alongside policymakers, local government leaders, and other healthcare professionals. And on this slide, you can also see another strategy, which is involving our community members at every stage of the project. Since the beginning, from co-designing of the model of care to numerous workshops about operationalizing it, and having training sessions, ensuring people-centered competencies are learned and shared with other healthcare workers as well. And I'm proud to say that through these workshops that we've conducted, I was able to witness how the healthcare workers were able to rely to the expertise of the patients, of the expertise of the Yellow Warrior Society as a critical source for them to understand what are effective counseling strategies that they can use for their daily work in terms of managing their clients. And beyond that workshop participation, we've also seen how Yellow Warrior Society, alongside other community members, have taken on leadership roles in our initiative. They've served as members of our community advisory board, informing our model of care, directing or giving us feedback about what IEC messages is important and would resonate with the public. And now, as Beth mentioned earlier, some of the Yellow Warrior Society members, including Diane, are now hired as research partners in the patient journey mapping that we are doing in Metro Manila. And together, we are now co-producing knowledge, coming up with interventions, identifying how we can scale the initiatives that we've started in our pilot implementation. And finally, this slide, this is very important. We've prioritized social connection beyond just work, social gatherings in the form of shared meals, informal conversations, and lots of karaoke, which we all love to do. This is very important, just as much as the formal gatherings that we've come to share all together. And this informal interactions reinforce the trust and the commitment that's required for us to sustain our work and make all the work more enjoyable for all of us. And I think I can confidently say that we've benefited, us researchers and academics alike, and other healthcare workers have benefited from having Yellow Warrior Society members alongside us throughout this initiative. And I'm curious to know, how about you, Diane? What do you think are some of the benefits that you've experienced personally and for the whole organization of Yellow Warrior Society?
Thank you for that question, Jhaki. Yellow Warrior Society of the Philippines likely values a partnership. StITCH helps Yellow Warrior Society of the Philippines increase the visibility and exposure through joint events, campaigns, and other forms of collaboration. We reach a wider audience. The organization has been able to help a broader range of individuals and raise awareness of the challenges facing the community. Also, StITCH strengthens the YWSP's capabilities by bringing in new skills, tools, or training opportunities. This can be especially valuable for a growing platform focused on supporting the patient group. StITCH has made a significant difference in how I feel about the engaging with healthcare providers, moving from fear and discrimination to feeling empowered and supported is a profound shift, and it's so inspiring to hear how the person-centered care approach has positively impacted our ability to monitor our and manage our health. The model of care we have created together for our healthcare system has improved our healthcare system. By creating a more inclusive, compassionate model, the StITCH project and similar initiatives are paving the way for a better experiences and outcomes for everyone. The fear of discrimination is unfortunately something many patients face, and it can create a barrier to seeking care or even having open and communication with providers. It's great to hear that StITCH helped to address this, and that the system is aligning a more patient-centered approach, one that truly focuses on the individual's needs, comfort, and dignity. We're glad that more than the initiatives towards reducing stigma and discrimination for the model of care, we've been a part of advocating for the normalization of living with hepatitis in the global stage through our representation in World Health Assembly storytelling. This served as a tool for reflection and sharing experiences, has empowered me and our community. Since we are trained, we became trainers for other patients to be trained. We learn to collaborate with the government to co-design policies and ensure that the patient voice in pathways to care. And StITCH understands the perspective of people with life experience. Working with StITCH elevates the advocacy efforts of Yellow Wire Society of the Philippines, allowing us to amplify our voice on topics that matter to the community. Overall, this partnership has enhanced the Yellow Warrior Society Philippines' effectiveness in meeting our mission, providing most robust to support the community in creating an environment of continuous learning and growth. Thank you. Over to you, Beth.
Yeah, thanks, Diane. And it was mentioned by Diane briefly, but I do want to really highlight the how proud we are to have involved the Yellow and partnered with Yellow Warriors at really big global advocacy events like the World Health Assembly for the past 3 years, so 23, 24, and now this coming May, it will be our third iteration of an event at World Health Assembly that we co-host on celebrating people-centered care. And you can see here some of the photos from 2023 where we had Jhaki, one of our other collaborators, present and share her story for the first time in a public setting. She then went on to I would say push Diane beyond her comfort zone to become the next advocate. And Diane joined us in 2024 and spoke in front of a much even bigger crowd at the World Health Assembly, sharing her story like she shared with you today. And then that photo just down the bottom in this slide is just last week when I was in the Philippines, and together Diane and Jhaki and I were starting to prepare Imi, who is another Yellow Warrior member who will be joining us in 2025. So that's just been a really beautiful example of the way that their leadership has, yes, it's very important at the local level. within our model of care with our healthcare providers. At the national level, even just last week, Diane and Jhaki were part of a national working group on forming the action plan for hepatitis for the Philippines, something that sort of our PI, Dr. Janice, wasn't able to even be there, but we had the Yellow Warriors there representing the project, which was amazing. And then even on the global scale. So yeah, it's really a truly co-leadership and one of the most rewarding parts and fun parts of this job for me. So yes, just wanted to brag a little bit about Diane and her colleagues and from that perspective. I think we're looking ahead now, right, Diane? We've got maybe one more comment.
Yeah, I would like to add more details about the amazing role that I played in the World Health Assembly this 2024. During that moment, I transitioned from being shy to overcoming my fears and found the courage to share my life experience with an international audience at the World Health Assembly. And I became an inspiration to patients who continue battling this disease and a voice for many Filipinos who are afraid to share their patient journey, challenges, and life experience. Thank you.
As we look ahead then,
Yeah.
I guess, what do we see for the future of this partnership? It's already achieved so much. How do we sustain and build on what we've started here, Jhaki and Diane? Maybe you over to you, Diane, first.
Yeah. For me, personally looking ahead to a future lasting partnership is to sustain collaboration and mutual growth. It might involve being open to learning and adapting, the trust, adaptability, and shared values, the continuous training and capacity building among patients so that each city may have a leader. Include the patient representatives in major decision-making processes to ensure our perspective continue to shape the project. And it has not only improved the system overall, but has also placed a strong emphasis on people-centered care, ensuring that the needs and well-being of patients are at the core of everything we do. By these principles, the partnership can continue to evolve in a way that strengthens its impact and ensure lasting benefits for patients, healthcare providers, and all involved stakeholders. How about you, Jhaki?
Thanks, Diane and Beth. For me, I see our partnership as a model that can inform other approaches in primary care. And just want to emphasize how it's not just about hepatitis, but we've built frameworks on how to integrate people-centered care, ensuring that it is community-driven and it's integrated in the broader healthcare services. And I hope that our initiative can inspire other similar efforts in the Philippines or in other locations elsewhere, and that the support that we've slowly gained from leaders across all levels can continue to grow and expand to other disease areas as well. What about you, Beth?
Yeah. Well, opportunities like this to share our approach and the model that we've used here is one of the things I hope we continue to grow. And I think for me as well, what's been really important, although we just have our Filipino colleagues here today, is this is a bilateral, this is two countries involved. And it's been really, really beneficial for us to work between these two health systems, for these two teams to work from each other, and actually even the governments at the local and national levels to learn from each other. So I would hope that there's even more opportunity for that regional collaboration, regional learning, and teaching from each other, not us at Harvard sort of coming in, but sharing local insights that we've helped to pass on and to coach. And so, yeah, onwards, we've got another year and a half. So yeah, really excited to see what we can do together, and really excited to see the amazing questions coming through in the Q&A. So I think I'll pass back over to Louise and then Dr. Ivers, and then we are very happy to answer as many as we can.
A wonderful, thank you so much. Thanks for being here. A special thanks to Diane for sharing your story. It's so powerful. And so we do have a lot of questions. I'm going to start with maybe the question about the patient-centered approach and the people-centered approach, which I think here in the US, we have a lot to learn about that. This is one of the things I love about global health partnerships. Like there's really a lot of opportunity for learning on all sides. How did the healthcare providers, the health workers respond to some of this work? And, there's often either a learned or an implicit hierarchy of knowledge. And, part of that is the colonial realities of global health or of medicine or of the practice of medicine. How did the healthcare workers embrace this approach, respond to the yellow wires and the patients' stories and the people-centered care? Can you share a little bit more about that?
Yeah,
I think
Jhaki.
I can share some, and I'll start the conversation. Yeah, I think that's a really great question, and yeah, the hierarchy of the dynamics between healthcare providers and the patients here in the Philippines is a reality, and we've encountered that actually. But I think one of the strategies that is integrated in the project is that we employed continuous engagement with these stakeholders, making sure that we are with them throughout the process. If it's necessary to handhold them at every step of the way, we did that. So yeah, what I want to emphasize is that it takes really that continuous work and effort, especially for us in the beginning as like the researchers providing the technical assistance and trying to explain to the healthcare providers what is people-centered, how can you operate this in your daily work and daily routine. So up until now, we're still navigating and learning from what we've started, but it's definitely a reality that we had to contend with. But yeah, I think the key important thing is to us researchers is it's not just a one-time thing with our stakeholders. We need to really be to caution and to provide technical support in every step of the way, and friendship and commitment and effort to all their needs. Like, for instance, using, like, in terms of communication, like being open with our lines, using, um, adding them in Facebook, being friends with them in so many social media, just to establish like a more convenient access of communication and make them feel that if they need help in terms of how to operate, they can reach out to us. Yeah.
Yeah,
That's
thanks. I mean,
one of my answers.
the work is complex, like it's nuanced. It's not a memo that's released and says we're now moving to, people-centered care, and it takes time. And this may be related to some of the other questions coming in. So you talked about your time at WHA, and I know you're very connected at, district and regional levels. Can you say a little more about how you try to, or how you have influenced policy, and how you think about scale and scaling such a, connected model of care, because I think we could all learn from that.
Yeah, I can maybe take a go at that question. This is a great one, and I began answering it in the chat because it is really key to our pathway to sustainability, is that we want to make sure that the work that we're doing is answering questions that policymakers have in order to influence where we've identified gaps in the landscape. I didn't mention, but right at the beginning of the project, alongside patient journey mapping, we did a policy landscape analysis looking at the political or strategic levers from the primary healthcare model across both countries, and sort of assessing how where the gaps were and how ready each country was to be able to decentralize hepatitis care. And that helped us identify some very key gaps. And then from the beginning, in the Philippines, for example, the key gap we identified was that PhilHealth, which is the national insurance package, a system, the social health insurance, does not include any care, outpatient care for people living with hepatitis. The only places where people living with hepatitis could seek public health care in an outpatient setting was in a couple of provinces that had been demonstration sites, but those had been interrupted with COVID. So we, from the beginning, went in with the Ministry or the Department of Health as a partner, and with PhilHealth as part of our conversations and our co-design, to make sure that we are generating the sort of evidence that is needed. This is a research project to influence policy. So our part of what we're doing is a costing study designed to demonstrate the savings of being able to identify, intervene early, and manage patients and enable them to manage their own health in their community rather than the advanced stage of illness. So that's one way. And then, as I mentioned, we identified another gap was that there isn't really a national plan for hepatitis. And that's something that globally is advocated for, that whether it's integrated as part of a primary care approach or standalone. So the last time that national committee met to try and form a plan was in 2019. And we're happy to say that not only through our advocacy as a project, but leaders like Dr. Janice Ong, 2 weeks ago was the first time that committee has come together again to progress forward with the WHO's support, a national action plan, drawing on the sorts of experiences and the project, our StITCH project, to inform that decentralization. Diane, you were actually in the room for that conversation, right?
Yes, from the project launch, I'm always there until the implementation of project.
Yeah, so I think having a voice in the room and sharing our insights from patients and providers' perspectives, answering questions that are relevant, and really knowing the gaps that we're trying to target from the beginning.
Yeah, thanks. It's always lovely in these sessions. I get to see teams who are spending time talking about their partnership. And so I always really appreciate having the time to do that. You know, sometimes there's challenges, disagreements, differences of opinions, or even just the stress of being in different places and times. How does your team work through resolving conflicts or, strong differences of opinion? Or, I mean, I'm sure that a lot of karaoke and having food together helps. I think it does. Breaking down the barriers of and helping to strengthen relationships. But can you speak a little bit to, if that has come up, how you try to deal with that?
I can, or Jhaki, you can start. If you have something in mind.
Okay, just like a very quick answer to it. Yeah, in terms of like having conflict, I think we didn't really encounter something that's really dramatic in a scale, but in terms of managing conflicts, right at the beginning, it was important for us to pick out a local government unit, or like a province where local leaders are very much open to have research implementations being done to their sites. So having that support from the top like emanates throughout all down to the public health facilities, as they basically sort of um, obey orders when it's like it comes down from the leaders. But in terms of on a granular scale of managing conflicts and yeah, I think we've been there as research implementers in the middle, like arbiters in terms of what are some issues when it comes to facility level implementation. And as I've mentioned earlier, um, having that continuous quality improvement and meetings with our facility level per site. At first, we have this like co-design workshops where everyone is gathered, but on the side of that, we also have this like specific meetings with each facility to make sure that we solve or identify issues that are specific to each site and identify some solutions that we can come up with. So that's one. Like there's um like paying attention at a more granular level to identify some problems and how we can troubleshoot those things.
Yeah. And I would just build on that to say that it was so long ago now that it's almost easy to forget. But for the first 6 months of this project, before we even really formalized the relationships with government and with Yellow Warriors, we as a core team, UP Manila, Hai Vien in Vietnam, and Harvard here, we spent a lot of time like team building and getting to know each other on a personal level and understand some of the cultural differences in the ways of communicating. You know, to everyone's initial dismay, like we did a lot of, we had a Miro board with everyone's sort of preferences of working styles, a collective agreement of how we would work together. So those sorts of initial investments, which, you know, enable you to go fast later. And I would say there was a few examples where, yes, we actually were able to nip potentially big conflicts in the bud, and we haven't seen really big conflicts with stakeholders because I think we model as a team a really productive way of working together. We have an annual team retreat where we try and get feedback and understand how we can do better, and we apply those same principles, for example, the rosebud thorn methodology for understanding challenges and things we can try to do better. We do within our team, and then we model that and we do that with the stakeholders as well. But requires time to invest in that upfront and there's not like hard deliverables and that pressure. So we were really grateful. We worked with a partner, Gilead, that gave us such a generous runway to invest in that team dynamic, and then have continued to invest in that with our in-person gatherings once a year and our quarterly meetings together.
Thanks. Actually, that segues nicely into, we just have time for one more question, because I wanted to ask you, you mentioned Gilead, and one of the questions we have from the audience is about how if other pharmaceutical and diagnostics companies are participating or not in this work. And I'd also like to add in how you are finding the relationship in management in terms of industry, public sector, civil society. There's a lot of different stakeholders. How is the relationship in with pharmaceutical company? Thanks.
Yeah, thank you. I'd like to call out, I think Sam Kemp has joined as a participant. He was a member of the team from the Gilead side and has joined to support us today. Thank you, Sam. But I think that goes to show like that this relationship, this public private academic relationship partnership has been very different to the ways that I understood pharmaceutical relationships in academia before starting this project, in that we really are, Gilead has been a thought partner and collaborator from the beginning. Of course, that meant really setting things up well with clear firewalls to ensure no conflicts of interest. And there's more sort of detail to speak to about that. But really, I think what's the difference here is that Gilead had a vision to be able to contribute to global health, not just in the innovation of their products, but in understanding how we can help work together to innovate in service delivery. And so it's been a very different partnership. We have a steering committee with key members of Gilead on the team with our leadership team. They're part of our in-country meetings and really have been a critical part, not just as funders, but as thought partners and as friends, as the comment from Sam, I think, highlights there in the chat as well. But Diane, I'm not sure, do you have any further comments? Although I realize we're at time.
Yeah, I was just going to say we're at time, but I do want to give Jhaki and Diane like 30 seconds to say anything else you had come here to say. You didn't have time, so you two get the last word. Maybe Jhaki and then Diane.
Yeah, thank you. I just want to thank having this opportunity to share about our experiences, and I had a great time looking back at all of our shared moments together, creating the pictures, identifying when was this? Oh, this opportunity made me realize how rewarding it is to really work with community partners and um, establish friendship with them over time. Yeah,
Thank you.
and I hope we were able to provide helpful insights to our attendees as well.
Oh, really enlightening. Diana, you get the very last word. Thank you so much for being here.
Thank you so much, Dr. Louise, and then the StITCH team, because they always choose our organization to be their partner. Because I'm so grateful because I saw the transition from the start of the project until the implementation. So thank you so much. Good evening.
Thanks, everyone. We really appreciate your time. Thanks to our audience, and have a great evening there in the Philippines. A great rest of your day, everyone.
Thank you. Have a great day ahead to everyone.
Thank you, then.
Thank
Have a
you.
great day ahead.